Well, I went to the University of Georgia from '03 to '07. And then after that, I was accepted into the Medical College of Georgia. So I attended there until 2011. And then following there, I matched into orthopedics in Indianapolis, Indiana. And that was through the Indiana University School of Medicine and graduated there in 2017. I grew up in a small town in the northeast corner of Georgia, and it's Toccoa, Georgia, also in Stevens County. And that's where, from when I was 3 years old onward, that's what I called home. So I was born in Indianapolis, Indiana, but raised in Toccoa, so I consider myself a Southerner because that's pretty much all I knew growing up. Well, that's a great question. I come from a long line of uh, doctors and surgeons. So my grandfather was an ophthalmologist in Indianapolis. My dad was an ophthalmologist but retired a few years ago in Toccoa. And then I have an uncle who's a neurosurgeon, another uncle who's a ER physician, and then I have an aunt who is a dermatologist. So a lot of medicine in the family. And when I was in college thinking about what I do for a career, I was actually the only grandchild to carry on the tradition um, of my grandfather, or the only one in my generation to go on to medical school. And it started when I went to shadow my dad in Toccoa. He was doing some cataract surgeries, and they were interesting, but I kept hearing all this racket from the room next door, and it was the orthopedist in town. Um, and so I asked the hospital if I could shadow him some, and I remember shadowing him for that day. I actually remember every surgery that he did, and I found it so fascinating what he was doing because it was a lot of things I like to do at home anyway, working with power tools or unpowered tools, hammers, that sort of thing, and putting things together, working with your hands, and with orthopedics, a lot of it is kind of like Legos. You're building and putting things together, and I found that very interesting. And that was in college when I shadowed him, and so that's where I kind of got bit by the orthopedic bug, and then that propelled me on to medical school, and then from there into orthopedics. Well, there's the human element, which is the biggest piece of this. I like engineering and I like working with my hands, but at the end of the day, the best part about it is taking care of people. That I've had many instances where someone comes in with a complex problem. Uh, One gentleman sticks up in my mind, had some prior surgeries, and just because things didn't heal the way they should have, he hadn't walked in about 2 years. And he came into my office and we talked through some things, and it was going to be a big operation, but he wanted a chance at walking again. And we went through the operation, and it turned out to be a big operation, and he did well. And I'll never forget when he walked back in the clinic, and he hadn't at that point walked in about 2 years. So as much fun as building with my hands and working with power tools and all those kinds of things are fun in the operating room, what's most fulfilling about it is changing people's lives. And that runs the whole gamut. I mean, some people are having a little bit of knee pain, and you help that a lot of times non-operatively, and you can get them back into doing things they enjoy, but that can run the whole spectrum to someone who hadn't walked in 2 years, and now they're walking back in the clinic. And everywhere on that spectrum is fulfilling. I see from an orthopedic standpoint pretty much every body part. Now, for the neck and the back, I do not do spine surgery, but I see a lot of back pain and neck pain because most of that can be treated non-operatively. And as far as surgical treatment, I work on the hand, wrist, elbow, shoulder, hip, knee, and foot and ankle. And that includes arthroscopy, which is minimally invasive surgery where you use a tiny camera, tiny incisions to go in there and treat different issues. And that's on the wrist, elbow, shoulder, hip, knee, and foot and ankle. And also do joint replacements of the shoulder and the hip and the knee. And I had extensive trauma training in my residency in Indianapolis, and I do a fair amount of trauma that comes in to our area. And then we also had an extensive amount of uh, children's type issues at Riley Medical Center, which is the level 1 trauma children's hospital in Indianapolis. And so I got a lot of experience and training working with children. And so I continue that in my practice to work with children. A lot of trauma I see, but then there's also more chronic type issues that I can treat as well. And then I also take workers' compensation patients also. Well, I have a wife and 4 children, so most of my time outside of work is spent with them, and it's been fun because they're very involved in the community. In Warner Robins, we have 2 daughters, and they're involved in cheer and gymnastics and dance. And then my son is involved in baseball and football. And my youngest son, he's 5, so he just started t-ball this past year, which was a riot, to say the least. So I enjoy being involved in their activities. And then as far as me personally, if it's my time, I enjoy playing the guitar. I've done that for years. It's a great stress reliever, and it's a way to use a part of your brain that's different than what you're using the rest of the day. When you're at work or in surgery, so it's very relaxing. And then I also have a motorcycle, so I enjoy riding that as well. When I was getting done with my training in Indianapolis, we wanted to move back home, and my wife grew up in Blakely, Georgia, which is Early County, which is a small town in southwest Georgia. And then I grew up in Toccoa, Georgia, small town in northeast Georgia. And geographically, we looked at Warner Robins, Georgia, and the Macon area as well. We knew we were small town people and we could not handle Atlanta, so that was out of the question. And as we began looking, it became evident that Warner Robins had a lot of things that were attractive for us, namely a great place to raise a family. They have very good school systems there, and our kids are in the public school system there and very happy with it. And it's also a family-oriented place, a safe place, um, you know, for raising a family and to call home. And OrthoGeorgia, as we began looking at it, it became evident that it was a great practice to be a part of. And so we're happy and privileged to be part of that practice now.